Which of the following passes posterior to the hilum of the lung? Vagus nerve, phrenic nerve, superior vena cava or right atrium. Posterior to the hilum of the lung is the vagus nerve. Anterior to the hilum of lung, phrenic nerve. What is the level of the pulmonary valve? Third intercostal space, fourth costal cartilage, third costal cartilage or second intercostal space? The correct answer is the third costal cartilage. Lower limit of the inferior border of the lung in the mid-axillary line is 6th rib, 8th rib, 10th rib or 12th rib? Mid-axillary line, 8th rib. Great cardiac vein lies in tricuspid valve, anterior interventricular sulcus, posterior interventricular sulcus or none. Great cardiac vein, it lies in anterior interventricular sulcus, and in this sulcus another structure, it is the anterior interventricular artery or LAD. Apex of the lung lies at what level? Above the clavicle, below the clavicle, at the level of the clavicle or none? Apex of the lung, it lies above the clavicle. Diaphragm is supplied by phrenic nerve C2, C3, C4 roots, thoracodorsal nerve or long thoracic nerve. Diaphragm, the motor supply to the diaphragm is through phrenic nerve. Midpoint between suprasternal notch and pubic symphysis passes through which plane? Transpyloric plane, transtubercular plane, transifoid plane or none? It passes through transpyloric plane. Muscle lying between anterior and middle layer of thoracolumbar fascia is psoas major, quadratus lumborum, obturator internus or external oblique. Between anterior and middle layer, the muscle is quadratus lumborum. Between middle and posterior layer, erector spinae. Anterior rectus sheath just above pubic symphysis is formed by external oblique aponeurosis. The aponeurosis of three muscles, including external oblique, internal oblique, and transversus abdominis, linea alba, or internal oblique only. So, above pubic symphysis anterior layer, it is made up of aponeurosis of all these three muscles. Right suprarenal vein drains into inferior vena cava, right renal vein, left renal vein or accessory hemiazygous vein. Right suprarenal vein, it drains into inferior vena cava. Left suprarenal vein, it drains into left renal vein.